it's definitely something that um, patients in Malaysia can benefit from. And it's a good thing that parents are becoming a bit more aware as the years go by about the importance of getting their kids treated earlier whenever there is a problem. And I think that in general, Malaysian dentists are a really passionate bunch. They are also very progressive in providing the best care for their patients. So there's definitely a need for this in Malaysia. Yeah. At that point, I think I was really searching for a course that taught the basics and the fundamental stuff about early interceptive work. A lot of courses back then were held and they were teaching based around an appliance instead of the knowledge and understanding how to diagnose and how to treat. We were taught some functional appliances, how to use removable appliances to keep teeth, the really basic things, but we weren't taught about growth. I think a huge part of doing interceptive work for children is understanding growth as well, the type of growth that we're dealing with. Yeah, and I felt like your course was really thorough, and like the knowledge is there, how to diagnose and then how to treat and the protocols. I would say like it's an all-rounded course. Thank you so much as well. I think without your mentorship, I wouldn't have been able to be where I am today as well, in terms of providing this kind of care and treatment to the patients that I've been treating in Malaysia. Yeah, so it's a really valuable course, I would say, and it's something that I always recommend to fellow colleagues who ask me on, which course I did.
So thanks so much for joining us today, Ruru. So we have one of our guests today, a former student, Dr. Yueh Tham. We wanted to just touch base, see how you're going since you first started the process. So at the moment, where are you practicing and what type of dentistry are you doing, Ruru?
Currently I'm practicing in Adelaide, and for everyone who's listening, I am new to practicing in Australia. So I'm about 2 months in. So I'm still sort of finding my feet at the moment, doing general work before I feel ready again. And I'll probably get started with whatever I love doing, which is interceptive work. Yeah.
Oh, wonderful, wonderful. So in Malaysia, where you were originally trained and
Yep.
grew up, what was the focus point of your primary interest the last few years?
That would definitely be orthodontics and also early intervention orthodontics. Yeah.
Oh, very good. It's something that we met through the Postural Orthodontics program
Yeah.
earlier in the 2020s. Actually, I think at the start of COVID.
Yes.
How did you come across our program, and what in particularly attracted you to postural orthodontics?
Well, so at that point, I think I was really searching for a course that taught the basics and the fundamental stuff about early interceptive work. A lot of courses back then were held and they were teaching based around an appliance instead of the knowledge and understanding how to diagnose and how to treat. I was searching for answers. I was looking up online and I was scrolling through Facebook one day and I came across a photo of a Malaysian dentist that posted of you. I think she probably attended one of your talks in some conference based in Melbourne. I'm not too sure of the details. But yeah, she tagged you in there. and she posted what you do, Postural Orthodontics, and a few Google searches later, I came across your course, and it was also very coincidental that it was COVID at that time, and your course was made online. Yeah, and I found that it was the perfect time to start learning something new.
Oh, fantastic. Had you had any exposure to early intervention or interceptive orthodontics prior to my course?
I did as part of what we were taught in uni, but it was really basic. We were taught some functional appliances, how to use removable appliances to keep teeth, the really basic things, but we weren't taught about growth. Um, yeah, I think a huge part of doing interceptive work for children is understanding growth as well, the type of growth that we're dealing with. Yeah, and I felt like your course was really thorough, and like the knowledge is there, how to diagnose and then how to treat and the protocols. Yeah, I would say like it's an all-rounded course.
Oh, thank you.
Yeah.
You were part of that initial um, mentorship program where we kind of met every couple of weeks online. How did that help in your journey? Just having the frequency of the attendance.
I believe that we met every fortnightly. And that frequency was pretty good because that was the frequency in which we reviewed our patient anyway. So with the mentoring session, you help to point out what is going right, what was going wrong, and of course, by being a beginner, you don't know what you don't know until someone who's experienced points it out to you. And I find that that was like one of the most valuable things I can get from the mentorship. And then yeah, you've also always been transparent about your protocols and your advice on what needs to be done. So as I find that so long as I follow through with what you advise, it usually works out. Yeah.
You're Malaysian trained and born and raised, which is incidentally where Kian and myself are originally from. Each country has a different view as to early intervention ortho. How is the general dentist and the orthodontist view of early intervention in Malaysia?
I think that is definitely a field that's increasingly being accepted by both patients as well as dentists. So it's definitely something that patients in Malaysia can benefit from. And it's a good thing that parents are becoming a bit more aware as the years go by about the importance of getting their kids treated earlier whenever there is a problem. And I think that in general, Malaysian dentists are a really passionate bunch. They are also very progressive in providing the best care for their patients. So there's definitely a need for this in Malaysia. Yeah.
Very much so. This is our experience, having dealt with quite a larger number of Malaysian dentists and orthos at this point in time. The process that I teach involves obviously the technical component of laboratory-based appliances. The exchange rate, unfortunately, isn't very favorable to the Malaysian ringgit and Australian dollar.
Yeah.
At the end of the conversion process, it didn't make that much sense for you to get Enrico to build the appliances, but I understand you ended up thinking outside the box and finding your own lab and training them. How was that experience? What were the problems and the benefits of working locally with a lab?
Well, to answer that question, I think I was quite fortunate because I was able to find a technician, Mr. Siva, who makes these appliances for me. So he's not completely new to making these appliances. He's had prior training before. It's just that it's difficult for me to to, get him to make the appliances the way Enrico does it for you. As much as I can, I just try to draw diagrams for him and communicate with him with videos whenever something comes back that's not what I had in mind. Yeah, I think drawing and just speaking to him helps. Yeah, so and initially I find that the most difficult part was that because every technician's hand skill is different, you kind of gotta understand how to work around it yourself by, having a feel and also just thinking practically, how am I gonna insert this, where do I need to trim, how does this part clips onto the tooth. So it's just a lot of patience as well as faith that you eventually get there. Yeah.
Much so. I mean, your journey is the same as my journey. Our dealings with the technicians, they have a concept in their mind of how to build something, and it'll be 80% roughly what we have in mind ourselves. And then it's that juggling of that last 20% where, because of the specific nature of the way I like doing things, learned through trial and error. Hopefully the protocols were something that you could use to help gauge what was right, what wasn't, the drawing the design rather than writing the notes. The way we insert helps you understand why we want certain things in certain ways. So it's a difficult process when you don't have the support of the technician who is already versed with the appliances that I've created. But equally, if you can overcome working with a technician who isn't trained as such, then your growth is much stronger because you begin to really learn to be very adaptive, which is the nature of dentistry. There's never a straight line, and
Yeah.
the more
Yeah.
dynamic your capacity is, the less stressed things are for you eventually.
Yeah, I think being able to think out of the box and somehow make something that didn't work. Yeah, I think
Yeah.
that's like the part that you gotta learn and teach yourself. Yeah.
Over the years, you've done a fair bit of work with your technician. Many cases, a few cases.
Yeah, a handful of cases, like I would say maybe 20 to 30. I can't remember the exact number,
Sure,
but
sure.
yeah, good enough to be able to be familiar with the treatment and the appliances.
Wonderful. And we often get the barrier from Malaysian clinicians who are interested, of the costs of shipping appliances over from Australia. So we'll, if you don't mind, pass on the contact details of your laboratory and the technician, and hopefully with the training that you have given him and the fact that he's used to creating the stage 1 appliances in the form that we create in Postural Orthodontics. Hopefully that will be one less barrier for the Malaysian clinicians to have to overcome.
Yeah,
So yeah,
definitely. Yeah, I use Mr. Siva's lab, and I'm happy to pass on his contact number to you guys after the call.
great. Wonderful. That will help out the Malaysian clinicians. Wonderful. So I'm very proud of you that you were able to push through all the barriers. Being a general dentist, doing ortho is one barrier. Not having a direct supervisor in the clinic is another barrier.
Oh yeah.
Or not having a lab that already knows the appliance these are all barriers that not everyone can overcome, and you should be very pleased with yourself, and it's very fortunate for your community that you were able to provide that care. Had you been able to wrap things up before you left your practice?
Yeah. I was fortunate enough to have colleagues as well who were happy to take over some of my cases. And
Mhm.
I think to today, they still send me photos of the patients' follow-up photos. Yeah, and we discuss it together. Yeah,
Oh, wonderful. So
yeah.
were you able to implement both the appliance as well as the exercise program? Like, what did you think ultimately of the GOPex training itself?
I think that the GOPex training is something that's really simple to teach, simple to understand as well. And in terms of getting the children to practice that, I feel like it's also really simple. So yeah, it's something that's predictable, reproducible, and you don't have to think too much into it.
Well, thank you so much for sharing your journey, and I'm very pleased that you were able to overcome the little hurdles that are obviously present for moving from one country to another.
Mm.
Congratulations on being able to pass all the exams and
Yeah,
get your qualifications in Australia.
yeah.
So you've got a new practice, a new life, and we're wishing you every success in your journey. And we're very pleased that now there is a postural orthodontic clinician in Adelaide as well. So that's excellent.
Yeah. Yeah, thank you so much as well. I think without your mentorship, I wouldn't have been able to be where I am today as well, in terms of providing this kind of care and treatment to the patients that I've been treating in Malaysia. Yeah, so it's a really valuable course, I would say, and it's something that I always recommend to fellow colleagues who ask me on, which course I did. Yeah.
Oh, wonderful. Well, thank you so much, Ru. That's just wonderful.